Hello, I'm Dr. Mangala Devi. I'm a fertility consultant and director at Smile Baby IVF, Bangalore. In addition, I am a gynecologist and chief obstetrician at KC Raju Multi-Speciality Hospital and Shishuka Hospitals. So since the past year or so, COVID-19 has ravaged our lives and caused a lot of changes. People are unaware as to whether COVID affects their fertility and what happens once they become pregnant. We have a regulatory body called ICMR in our country which lays down the ground rules for how to deal with COVID in pregnancy. So it has been seen that pregnant women do not appear to have an increased risk from COVID. However, in a pregnancy, the immunity of a pregnant woman is lowered, and as they are equally susceptible to other viruses, so also they are equally susceptible to COVID and its complications. However, it is not clear whether they are a separate group as such. Another question that comes to everybody's mind is whether COVID is transmissible to the baby. It has been shown that COVID is showing some kind of perinatal transmission to the baby. However, the proportion of cases that have been affected and the severity of effect is not yet determined. So it is better to take medical help as and when necessary and to take all the precautions that is necessary during a pandemic. What is the effect of COVID-19 on the fetus? At present, there is no data to suggest that a COVID-19 infection can lead to either miscarriages or it can lead to abnormalities or teratogenic problems in the fetus. It is seen that COVID-19 has been associated with a slightly increased risk of preterm labor, but nobody is sure whether this is iatrogenic or whether it is an inevitable complication of COVID. However, at present, there is no need for a person with COVID-19 to think of a medical termination of pregnancy just because they have COVID-19. Antenatal care in COVID-19. So how often should the patient visit the doctor in case of a COVID-19? The patient should limit her antenatal visits if she does not have any complications to once a month in each trimester. The reason being to prevent exposure to COVID-19. However, if a patient's appointment is due and if she is symptomatic, she can wait for 7 days from the time the symptoms show up for alleviation of symptoms before visiting the doctor if there is no other complication. However, in case someone else in her family shows symptoms of COVID and the patient has tested negative, it is better to delay the appointment for a period of 14 days from the time the person has tested positive. Apart from that, it is also important that the patient keeps a note of her immediate health. If there is any deterioration in symptoms or if the symptoms are prolonged, it is necessary that she meets her maternal health provider as soon as possible. What about labor and delivery during COVID-19? So it is seen that labor and delivery can be allowed to progress normally even if the patient is suffering from COVID-19 unless she has severe respiratory distress. So cesarean is done only for purely obstetric indications and not just because she is suffering from COVID-19. Even spinal or epidural anesthesia is not contraindicated in case of COVID-19. However, if a general anesthesia is necessary, extra precaution should be taken by the healthcare workers. As far as breastfeeding is concerned and post-delivery care is concerned, breastfeeding is not contraindicated and it depends on the institute. However, if the mother is positive and the baby tests negative, probably pumping of breast milk is indicated as till now COVID-19 has not been detected in the breast milk.